Now we are looking at cannabis and cannabis-based medicinal products, which is one of the fastest evolving areas of pharmacy law. Since changes in legislation in 2018, pharmacists have needed to become familiar with the different categories of cannabis-based products and the different rules that apply to each of them. Cannabis itself contains hundreds of chemical compounds. Among these, the two most important are THC and CBD. THC is the psychoactive component responsible for producing the characteristic high associated with cannabis. CBD, in contrast, is non-psychoactive and is associated with various therapeutic effects without causing intoxication. There are several categories of cannabis-based products, and each has a different legal and regulatory status. The first category is licensed medicines. These products have gone through the full licensing process and have marketing authorizations. One important example is Sativex, which contains both THC and CBD and is used in multiple sclerosis-related spasticity. Another is Nabilone, a synthetic cannabinoid used for nausea and vomiting associated with chemotherapy. Epidiolex is another licensed product and contains purified CBD for certain severe forms of epilepsy. The second category includes synthetic cannabinoid compounds that may not necessarily be licensed in the United Kingdom, but may still occasionally be encountered in practice. The third category is cannabis-based products for medicinal use, often shortened to CBMPs. These products were moved into Schedule 2 following the legal changes in 2018. They are unlicensed cannabis-based medicines prescribed by specialist doctors. Because they are Schedule 2 controlled drugs, they are subject to all the usual Schedule 2 requirements, including prescription rules, controlled drug register entries, safe custody, and destruction requirements. An important practical point is that these unlicensed cannabis-based medicinal products can only be prescribed by doctors listed on the Specialist Register of the General Medical Council. They cannot be prescribed by general practitioners, pharmacist independent prescribers, or nurse prescribers. It is also very important to distinguish between different cannabis-related products. Sativex is a Schedule 4 controlled drug, whereas unlicensed cannabis-based medicinal products are Schedule 2 and therefore subject to much stricter controls. CBD-only products that contain only tiny amounts of controlled cannabinoids are generally not classified as controlled drugs and are often sold as food supplements, although the quality and consistency of these products can vary significantly. In practice, patients may ask about medical cannabis, and it is important to understand the distinction between licensed medicines, unlicensed specialist-prescribed cannabis products, and commercially available CBD supplements. Some patients may also present with private prescriptions for cannabis-based medicinal products from specialist clinics. These prescriptions are legal provided they are issued by an appropriately registered specialist and should then be handled according to all Schedule 2 controlled drug requirements. For exams, the distinctions between the different categories are extremely important. Remember that Sativex is Schedule 4, while unlicensed cannabis-based medicinal products fall into Schedule 2. Epidiolex is a licensed CBD product. Unlicensed cannabis-based medicinal products can only be prescribed by doctors on the specialist register. And finally, THC is the psychoactive component, whereas CBD is non-psychoactive. That brings us to the end of the controlled drugs section. This area forms a major part of both pharmacy law and day-to-day professional practice, so it is worth revisiting regularly. The next section moves on to other important topics, including unlicensed medicines, clinical trials, and medical devices.
This video is part of a video library from Pharmacy Skills. Pharmacy Skills is one of the most comprehensive pharmacy training libraries. Please visit www.pharmacyskills.com to see more videos in this series.